Answer me. Vision. Okay. Have you all heard about that Sarvendriyanam Nayanam Pradhanam? Yes, no? Vision is very important for us in day-to-day life, na? Okay. So, since eyeball is very small, even though eye is very important, like in vision, everything, but somewhere the importance is given little less compared to other body parts. Okay. So, not much people know about the parts of the eye. So let me give a brief introduction to the parts of the eye. Then it will be easy for you guys to understand what are the conditions related to that. So here comes the eyelids, eyelashes, eyelids, and what you are seeing, this curved part is the cornea. What appears black? Actually, it is not black. It's a transparent part, but it appears black. Okay. Then the oval shape, what you are seeing is the lens, which is very much transparent, like how you wear glass. And over a period of time, when you become like aging, that the transparency will be lost, and that is called as cataract. Okay, are you guys able to see? And what the orange lining, what you are seeing is the retina. Okay, when any patient diabetic or hypertensive, when it's not under control, that is the layer which will be affected. Okay, so let's go to the. So generally, what happens? How do we see things? Whenever you see any picture, the image will be focused, it will pass through cornea, lens, and then it falls on the retina, on the vision area. This is the optic nerve which comes from the brain. Okay? So, how it passes, because the cornea is transparent, lens is transparent, if it's transparent only, the image will go and focus on the retina. Okay? If the image is not focusing on the retina, if it's focusing little front or little behind, that's where the patient will start developing refractive errors like myopic, far-sightedness, nearsightedness, all these issues will start. Okay. So today I'll be talking about two very common eye disorders like dry eye or computer vision syndrome, allergies, eye-related allergies, refractive errors, short-sightedness, long-sightedness, then cataract which happens because of aging, glaucoma and diabetic retinopathy. First of all, very simple topic which is very commonly predominant in our society, computer vision syndrome. So what are the symptoms when someone is having computer vision syndrome? Not everyone will have computer vision syndrome, no? Which population of people will have this symptom very commonly? Any guess? Okay, why others don't use computer? More use. Nowadays everyone use screen more, not only they. Okay? So predominantly is common in IBS. So what are the symptoms? Any guesses? Not whatever everything is written here will be experienced by the patient. So typically irritation, burning sensation, mild watering and mild redness will be the symptoms of the patient. Symptom is what patient experiences. Signs is what doctor sees. Okay? So an intolerance to the light. So what causes this? Why all software employees get computer vision syndrome? Because they use laptop. What happens with laptop?
Blue light.
Then
They stare at
they keep staring at the screen. It can be computer or your mobile phones or laptop, even TV also. Okay, staring at the screen for very long time without blinking and very much infrequent blinking. All these causes computer vision syndrome. Sometimes even exposure, too much exposure to the AC also can cause dryness and computer vision syndrome. Okay. So what are the complications regarding? If you keep staring at a monitor for a long time without even blinking, what happens? After 2-3 hours you start feeling okay, some kind of irritation, your eyes are pulling, some kind of disturbance will be there. There won't be any blurring of vision, but you will have some kind of disturbance. Intolerance to light, mild headache, all these things. So how can it be treated? It can be treated with the usage of lubricating eye drops. Okay. Along with that, first more than treating, how do you prevent that? How do you take care of that? Treatment is given by us, but what else you can do from your side is frequent and complete blinking. Take a frequent breaks from the screen and avoid direct AC airflow to your eyes. Okay, and you have to lower down your screen also. Avoid direct exposure to LED and looking downward from the monitor. and regular usage of lubricating drops. And first, more important thing is frequent blinking. Blinking will help you spreading the tear film on the ocular surface. Okay. Then coming to the second topic, dry eye. Any guesses what is dry eye? What is dry eye? Any guesses? Where there is decrease in tear film formation, tear drops of decreased formation is there. It is called dry eye. So, is the tears good or bad? Good. I thought you would tell bad. So, our eyes need enough tear fluid in our eyes. Okay. So, what happens? Our eye needs tears to stay healthy and comfortable. What do you mean by comfortable? If it's deficit only, you will have burning sensation, redness, everything. That's why you will start having problems. If your eye do not produce enough tears, then it's called dry eyes. Dry eye is also when our eyes do not make right type of tear or film. You do infrequent blinking, so tear film will spread only half eye, right? So the rest of the part will not be having any tear film. So naturally patient will still feel discomfort and watering. So what are the symptoms? Severe burning sensation, stinging, and sometimes on constant focusing, you may experience mild blurring of vision also. Redness, scratchy and gritty feeling, and patients who are like using contact lens, they'll have more discomfort if they're having dry eyes. Okay? So what are the causes? Like you all said, patients who are staring at the screen for long time also will have dryness. Then few other medical conditions also cause dry eyes, and few medications will also cause. Okay? And if you are in some smoky environment also, even that, like someone is doing too much of puja and all because of the smoke also, you may have this kind of irritation. Okay? So how do you treat dry eyes? Like I said, again it's lubricating eye drops and with frequent blinking. And treating the culprits, like if you are using any medications, because of that, if you are developing dry eyes, that has to be changed or stopped. And few medical conditions also causes dry eyes. Again, that has to be addressed. Then cold compressions to the eye, massaging your eyelids, and environmental changes. Like I said, if you are too much exposed to the AC, you may develop dry eyes. So, changing the posture of that or sitting away from the AC vent will prevent dry eyes. And like I said, the using of lubricating eye drops will also help you in dry eyes. So what are the prevention tricks? Protect your eyes from drying wind by covering it. Wrap around glasses which doesn't have space like this. Okay. Then avoid the smoky areas. Stay away from warm rooms, and in winter use humidifier so that the room moisture will be maintained and you will not develop dry eyes. And in supplementation of omega-3 fatty acids helps your eyes to be in good form, avoiding the dryness. And you will get that in different supplementary forms. Okay. When you reach out to the doctor, they will give you, after examining tests like Schreppers and all, they do it and they will estimate what kind of dryness you have. Dry eye is a general term. There are gradings in that. Okay, mild, moderate, severe. Based on that, if it's severe or no, then you will be prescribed omega-3 fatty acids. Along with that, we will be giving flaxseed, which has a supplementation. This is not given separate. It will be prescribed in a tablet form. And if any patient is diabetic, they will experience little more compared to the age group of that particular population. 5 to 10% the dryness issues will be more. What are the home remedies? Stay always hydrated, avoid caffeine, alcohol, and like I said, wrap around glasses. Can you see here? It's completely covered. Okay, this will help you when you're in the smoky environment or too much in the AC exposure. And blink more. This is the best thing. All of you should remember, blink more and frequently, and your blink should be complete. I can see one person blinking a lot. So third one comes the allergic condition, which is very common at your age group. Okay, allergy can be due to anything like dust, pollutants, or me going in contact with any other chemical substance, All these things can cause, and any patient having already issues of allergic rhinitis, asthma, eczema, they're more for developing allergic conjunctivitis. How do they present? How the patient comes? What are the symptoms? Severe itching in the eyes, redness, swollen eyelids, congestion, and even they'll be having a discharge, pain, irritation, intolerance to light. All these are allergic symptoms. Along with it, they'll have few may have allergic rhinitis, excessive sneezing and all. Okay. So, like I said, these are the common allergens like dandruff, dust, pollens from the trees, smoke, perfumes, cosmetics, mold, insect bites and stings. Sometimes when you're been using eye drops because of any other condition, the preservatives in the eye drops can also cause allergy, but very less, only for few patients. Coming to treatment, first of all, you have to avoid coming in contact with the allergens. Each patient will have a different history, so you have to avoid that particular condition. And eye drops will be given to reduce allergy. Again, allergies will be graded into different grades. Based on the severity, the particular drugs will be given for a period of time. The last one is the third one, very interesting topic, refractive errors. So, a person cannot see clearly because of the rays of light not focused on retina. The first image which I showed, the image of the person, image was focusing on the retina. So that is normal, that is emmetropia. When it is not focused, like in the front or in the back of the retina, that's where we'll develop refractive errors. So refractive errors can be myopia, nearsightedness. Nearsightedness means patient can't see for distance, they can see only the near one. Okay? And hyperopia is a plus power, patient can see far, they can't see near. Presbyopia is a condition which everyone develops around 40 years. That's when they start developing the need for reading glasses. And astigmatism, again I will explain you through the picture. So this is the normal eye where the light of image will be focused on the retina. Can anyone say where it is focused? The image in the front or back? When it is focused in the front of the retina, it is called as myopia. Okay, that's the minus power. I can see many of you are wearing glasses. Okay, so what happens with these glasses will help them so that the image will be focused on the retina. That is the use of glasses. It will help us to see clearly by making the image focus on the retina. Okay, and this is the astigmatism. Here the cornea, whatever you see, cornea is steep in one axis and it will be flat. This is a topography which shows the corneal curvature. Okay, in one axis it will be steep and one axis it will be flat. So what happens because of that? Patient won't be able to see. He will be having severe discomfort because there will be multiple focal points. Again, this can be corrected with the glasses. So what is this plus sign? It is for patient can't see the near one. So he will be having the power in plus. Okay. Here what happens? The focus of image will be beyond the retina. So again that is also a problem because it is not getting focused on the retina, right? So here what we are doing, the eyeball is too short. So it's going beyond. In myopia, the eyeball will be long. So that's why the image will be formed in the front. So what happens here, the eyeball is short and the cornea, this part will be flat. It won't be in its normal curvature form. So what happens, image will be forming on the back of the retina. Again here what we have to do, we have to do spectacle correction to make it like clear by helping the image to follow the retina. Okay. Presbyopia is one of the hyperopic correction only which happens around 40 years of age. So a form of hyperopic that occurs with age, and here there will be like eye lens loose elasticity will be having. Here the patient main problem will be like accommodation issues will be there, and based on their profession they develop around 38 to 45 years of age, and always corrected with the converging lens. They will be having only the reading issue. The distance vision will be always very good. So how do we treat all this? We have heard about so much of far-sightedness, near-sightedness, astigmatism. How do we treat all this? Glasses. Only glasses. Any other? Laser. Okay. quite advanced. Then, no, I got that. Good one. There's one more, which is very commonly used. Here, one is specs. The other one is laser, like you said. Here, one. There's something. What is that? Contact lens. So glasses, contact lens, plus people who doesn't want to use glasses, because nowadays glasses has become too fancy also. You get in different glasses also. So who not interested in glasses, they can either go for contact lens or LASIK. LASIK is the laser surgery. So let's give any idea about surgery, laser surgery.
18 plus.
You're quite expert. Then any other points? He seems to be having a lot of plans in the future. You're not happy with your glasses? Okay. So what is LASIK? Laser assisted in situ keratomeliosis. So what do we do here? So as I said, already told you, and one of your friend has told, to get rid of the contact lens, who is not happy with usage of glasses or contact lens, they can plan for the LASIK after 8 years. So with LASIK, your ophthalmologist uses a laser to reshape your cornea. When I was describing about the refractive errors, I was focusing on one point: image formation on the retina and the corneal curvature. Okay, here we'll be reshaping your cornea, and LASIK is used to treat myopia, hyperopia, astigmatism, but not presbyopia. Safe, effective, and precise treatment, and done very commonly today's. Who is good candidates for LASIK? He has already blocked the first point. Any other points? What is the second? Everyone who is 18 can't be getting LASIK done. No. What is the second point? Your vision, like your power, it should be stable. Okay, it should not be fluctuating. Like increasing power, we always wait for it to stabilize. Then only we plan for that. Second point also you remember. Your corneas need to be thick enough and healthy, and your overall eye health should be generally good. So whoever is planning for LASIK, we always look out for few points, like patient should be above 80 and their power should be stable. And like I've showed one around the circular green image where it was showing corneal curvature. We do even that and we estimate how thick is the cornea, whether it is thin or thick, what is best, what type of LASIK surgery is best for the patient. Okay, you need to have a realistic expectations about LASIK surgery and on what is the plus, what is the minus of the surgery, everything you should be knowing. Not everyone who is having glasses can be done LASIK surgery. So we first evaluate, and based on your criteria, then we decide for the LASIK surgery. Okay. So what to expect with LASIK? Any ideas? What are you expecting? You said you were a laser surgery and all. With laser surgery, what are you expecting? Getting rid of glasses. Yes. Then with full vision, na? Without glasses also, what is the criteria? You want to have full vision. So during LASIK surgery, it's an OPD procedure surgery. There is no admission or anything. It's done on OPD basis, OPD procedure. Anesthetic eye drops too. It's done by giving anesthetic local topical eye drops. And here what happens? This is the cornea, the curvature which I have been showing. Okay. Here what happens? We make a corneal flap, and this is the laser light. What is the role of laser light here? Laser, you are reshaping the cornea. Cornea curvature also coordinates with the power. Whether it's flat, whether it's too steep. In myopia, it will be too steep. So what do we have to do? We have to recorrect it. No. So by making a flap, we are altering the shape of the cornea to whatever the patient requires. Okay. So reshaping it through excimer laser. There are different types of lasers. So don't go by names. It's very confusing. So just remember laser. So what to expect with LASIK? After LASIK, there will be only simple post-operative care. Whatever according to the doctor's advice, patient has to follow it very strictly. So what is this condition? Anyone has any idea? This is also been experienced very commonly. This is called chalazion. So now I'll be only discussing about, now I've already told about the refractive errors and everything. Here I'll be talking about the swellings in the eyelids. It is of two types. So one is chalazion, which is like chronic condition, like patient will be having this kind of swelling for months, generally painless and but disturbing. Like it will like very obvious when someone sees at your eyes or anything. Okay. So and sometimes in the acute stage it will be little painful. But most of the time chalazions are well defined and chronic and painless. So how do you treat that? The only complaint will be like mild pain or some kind of discomfort from the patient side. So how do we treat? The beginning stages we give hot compressions, then by antibiotic course. Still it's not coming down. Surgery is not a big surgery, it's an OPD procedure. We make an incision and remove that, whatever the content is there inside. Okay? So what is this? This is type. Okay, very commonly seen with most of the patients. So here it is painful and sudden, acute. It is not chronic for long time. Okay. So here severe swelling will be there. Patient will be having pain with full swelling, redness, tenderness, everything. You can see the pus pointing out here and here. It can be of two types, internal and external. Okay, again here it will be treated with hot compressions, antibiotics still not residing, then incision and curate. And that stye and chalazion will not cause any blurring of vision until unless it's too severe and it covers the eyelid. Okay. Now blepharitis. Anyone has seen this kind of eye condition? Blepharitis affects only the eyelashes. Can you see? It will not affect your vision or anything, it will affect only the eyelashes. So it can be chronic condition, sometimes for many years. So symptoms will be severe irritation, watering, redness, and you can see like chalk dust on your like dandruff. All of you are aware of dandruff, no? It's almost like dandruff flakes you can see on the eyelashes, but that's not bad. Okay? So that is a sign what you can see in the mirror, but patient experience will be like severe redness, irritation, and sometimes it can be pain also with little discharge at the eyelids. Again, this can be treated. First of all, any patient suffering with blepharitis or any kind of white discharge or flakes on the eyelashes, you have to keep your eyelashes and eyelid healthy. Not just washing the face, even your eyelashes should be healthy. If you don't keep it healthy, this is what will happen. Okay, in such conditions, the patient eyelashes will be treated like with baby shampoo, Johnson baby shampoo or anything, and topical antibiotics or ointments, and then lubricating rooms. Eyelashes also should be clean and hygienic. Okay, most of them doesn't bother about the eyelashes, eyelid, anything. That's why you end up with these kind of symptoms. Next. Any idea? Does it cause pain? No. So let no pain. So this is subconjunctival hemorrhage, most commonly seen after trauma or in aged patients who have the history of uncontrolled hypertension. It's not a sign of infection or inflammation, it doesn't cause any blurring of vision. It subsides, it's a self-limiting one, within a week it subsides. So this is the most important topic. Can anyone read that name? What is cataract? You are not interested in cataract, you are only interested in LASIK. Anyone else? What is cataract? Due to? This is like loss of lens transparency. Is lens transparent is some color. What is the color of lens? Pakka. Milky and white. When it happens? Once you develop the cataract is losing the opacity, losing the transparency, which is transparent. When you are losing the transparency is called cataract. Here lens opacification is called cataract. Who and all experience cataract? Okay, aging means what? What age according to you? Cataract develops just like that, or is there suddenly one day you get up, you have cataract after 50, 60 or 70? So cataract is a gradual, painless, progressive loss of vision. Okay. So over a period of time, any aged person after 50 is experiencing day by day slight decrease in vision. That gives a suspicion of having cataract, or he may be developing cataract. How do they treat cataract? Nothing is laser surgery only, eye is laser surgery only. So, there is only one treatment option, that is surgery. Here, the opacified lens will be removed and the exact patient power artificial lens will be placed in the eye. And there is no medical treatment for this, no tablets or no eye drops will work for this, as it is only because of aging. And the exact surgery in medical term what we use is phacoemulsification. Like you can see, this is the image of the cataract which is being treated. Glaucoma. Have you heard about this name? No. Very important topic. So glaucoma, what happens before going to the symptoms, I would like to say in cataract and all there will be generalized decrease in vision where the patient can pick up immediately. In glaucoma, the peripheral field will be affected more. So patient till advanced stage, he will be having the tunnel vision, center tunnel vision. Okay. And again, this will have a family history like diabetes and hypertension. So any patients with family history of glaucoma in your family also, they have to go very frequently for the glaucoma screening. And in glaucoma, all of you are aware of like having even in the eye there is something called intraocular pressure. Body, you would have heard like hypertension, everything. Even in body, pressure is there. Are you aware of there is something called pressure even in the eye? Like how we have BP, everything related to the general body. We have pressure issues even in the eye. When the pressure is not under control, when this pressure is high in the eye, it will lead to the damage of optic nerve. And that will cause glaucoma. When such things happens, the patient will start losing peripheral field. So he will be having vision till the advanced stage, but in the tunnel form, the whole peripheral field will be decreased. Okay, so it's always a preventable one. Please, anyone in your family also is having any glaucoma issues, please do get it screened every year. Okay, so most of the time it is preventable only. And generally treated by eye drops with a periodic checkup, and if it's advanced, then only we take up for the surgery. So glaucoma will be affecting only the optic nerve. Can you see the changes here? It is pretty white here. Okay, this is normal, this is moderate stage, and this is the advanced stage. See how white it is. This is the optic nerve. If the pressure rises, optic nerve will be damaged, and that's where you will start losing the vision. Okay, what do people know about diabetes? What is diabetes? Glucose level? Decrease, increase? Decrease. Okay. What is the importance of that? Diabetes, what does it do? You would have heard, no? Diabetic checkup, diabetic screening. Blood pressure is hypertension. Increase in blood sugar is diabetes. But what does it do to our body in general?
If some food happens, it takes more time to eat.
What are the organs that will be affected? You can take a guess on this, no? Okay, kidney, then? You have to tell the condition also. Okay, kidney, then what else? What are these things? What is that? What is the first picture? So what does it do? Diabetes, hypertension. Patients, if it's not under control, patients having uncontrolled diabetes or hypertension, or at the risk of having stroke, cerebrovascular attacks. So what is the second one? What is this? You don't have any risk, huh? Diabetic patient, they can have no coronary artery disease. Then what is this? Already someone has told diabetic nephropathy. Then, have you heard about diabetic foot ulcers? If you are having uncontrolled diabetes, you may develop diabetic foot ulcer also. So diabetes, mainly I'll be focusing on three systems here. Diabetes can cause In eye, it will be damaging the retina, diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. Okay, if there are any issues with the neurological thing, it is neuropathy. Okay. Like you said, diabetes is a metabolic disorder with a chronic hyperglycemia, high sugars for long time. And diabetic retinopathy is one of the leading cause for the blindness in well-developed countries. It contributes around 4.8% of the 37 million cases of blindness throughout the world. And our country is one of the leading cause. It is like almost having quite a lot of percentage in causing diabetic retinopathy causing blindness. Already people are aware that India is the capital of almost diabetic now. How can it be prevented, diabetes? Apart from aged patients? Only food.
Proper exercise.
Proper exercise. Then periodic checkups also. Well, most of the time we keep assuming I am under good control, I am under doing lot of exercises and everything, but without knowing it, we'll be having other issues. Nowadays you are not listening up, many healthy patients are also developing all this. There is no age group now for diabetes. What is type 1?
Type 1 is inheritance. Type 2 comes in our life.
Lifetime is when?
Dependent and insulin.
Right. What you said is correct. Insulin dependent and like. So in type 1, in the first 5 years, it's very low risk of having diabetes. Okay. So once you cross more than 10 or 20 to 30 years of duration of diabetes, there is high risk of developing PDR, that is advanced diabetic retinopathy. When it comes to type 2, nearly till 10 years, the risk of developing PDR is like less than 5% compared to type 1. So type 1 people should be on more frequent visits. So what are the risk factors? Like most of you told, modifiable, non-modifiable. What you people told is modifiable. What are the non-modifiable? Duration, and at the age of presentation, and level of control of sugars, all these things. And there is one condition called gestational diabetes which happens during the pregnancy times. Even this is very risky. So modifying factors, like you said, people who are smoking, they should control that. Regular exercises, regular checkup, and HbA1c, with good control of HbA1c, and hypertension, and dyslipidemia. What is dyslipidemia? Well, that is very important, no? Lipids. Not proteins. Not that proteins, lipids. Not that chemistry. This is different. Not proteins, lipids, carbohydrates. This is different. This is triglycerides, all this, which is good, which is like you have to differentiate good fat, bad fat for heart. Okay, even if this is altered, dyslipidemia, derange of lipid profile in your body is also a risk. That will affect mainly heart. Next slide. So what are the symptoms of diabetic retinopathy? Generally, when the patient is having mild, moderate stages, they won't be aware of that they are having diabetic retinopathy. Only if it goes to advanced stage and without any tear, fracture or any bleed in the eye, patient will start seeing these spots, dark circles, something is floating in the eye. That will be the typical complaints of patient. I'm seeing nowadays some black spots. That is like bleed in the eye. Okay. So once it progresses to advanced only, they'll experience. Sometimes if the vision area is involved, even in the early stage, they'll be experiencing blurring of vision. Okay. Generally, it affects two eyes. Sometimes it can be of asymmetric presentation. One can be having more symptoms or more signs, the other can be having less. But most of the time, it affects both eyes. So this is the normal retina. Like I said, this is the optic nerve. If there is any uncontrolled pressure issues, this optic nerve will be affected and leads to glaucoma. And this is the main vision area called macula. This whole part will be affected in diabetic retinopathy if it's not under control. How different is this picture from the previous picture? What can you see there? What spots? Dark spots or red spots? Only red spots you guys are able to see. I can see something else also. Any guesses? Okay, this is the angiographic image of the fundus. So let's forget about that. Let's focus on this. So can you see these kind of multiple red spots? And there's something called yellow spots also. These are the yellow spots are called exudates and this is called hemorrhages. Dot and dot hemorrhages and all these are the signs of diabetic retinopathy. Based on the presentation, we divide it into mild, moderate, and severe and advanced form. Generally, when it's mild, moderate, we always ask the patient for regular periodic follow-up with a very strict sugar control. When it goes to advanced, the treatment changes. So this is the angiographic image. Doesn't it look scary? All these are advanced new vessels. That's where we have to intervene and treat it with laser. So we should not let anyone to go to that stage. That's why we always keep telling anyone who is diabetic or hypertension, periodic annual checkup is must. So what does it help? If any subtle changes have started, we can educate the doctor and refer to the diabetologist for further control of sugar so that all these advanced changes can be prevented. So it is generally seen in 90% of patients who have diabetes for more than 10 years. Like I said, diabetes control is very important, and with someone having around 60 or 70 years, they might be having associated complaints like hypertension also. So even that should be controlled, and lipid profile has to be under control, and who is more prone for smoking habit, they should also get it under control and stop alcohol and everything. And all these things will aggravate diabetic, and that will lead to diabetic retinopathy. Okay, so how it can be prevented by regular eye checkup right from the diagnosis, at the time of diagnosis of diabetes. So what did we understand from this? If any patient is diagnosed with diabetes on that day, at the earliest he should be having the eye checkup. If he doesn't have diabetic retinopathy at that particular time, regular annual checkups are being advised. Based on the symptoms, if he is diagnosed with diabetic retinopathy, again based on the symptom severity, we will be calling him for the regular periodic checkup, which is very must. So what is this picture showing? If you don't come for the regular checkups and if you develop diabetic retinopathy, still the patient doesn't turn up on time, this is what will happen. It will go to advanced diabetic retinopathy. Can you see the blood here? It will go to bleed and detachment. So any patient with diabetes has to be screened for diabetic retinopathy at the earliest. So most commonly at the time of diagnosis of diabetes. And based on this we call them for periodic checkups. Okay. So this is the normal diabetic retinopathy. Here you can see the advanced, like abnormal new vessels. If this is not treated, you will end up with the previous picture. So how do we treat diabetic retinopathy? Until unless it goes to advanced stage, like having abnormal blood vessels, we generally call the patients on regular periodic follow-up. So if at all it goes to advanced stage, retina will be treated like this. Can you see all these patches? What are these? Laser spots. Patient who is developing abnormal vessels, they will be treated with laser to make it shrink so that it will not lead to detachment and bleed. And most of the time it's medical managed through lasers, and sometimes we do give injections to the eye if they develop any swelling in the retina. And in the final stage, too much of detachment, advanced stage, always the treatment mode will be surgery. Can you see these white small tiny spots? Those are the laser spots. This will be the initial management. If there is advancement of diabetic retinopathy and still it's not settling, then we have to plan for the surgery. So all these things can be avoided if the patient comes at the earliest for a periodic diabetic retinopathy screening with a very good sugar control. Next. So for all eye problems, there is only one-stop solution, Shaker Eye Hospital. So please do visit, and tomorrow I think they are organizing a camp in the morning. So all of you can get your eyes tested there. Okay, any doubts? Not having doubt? No?
ನಿಮಗಲ್ಲದೆ ನಿಮ್ಮ ತಂದೆ ತಾಯಿಗಳಿಗೆಲ್ಲ ತೊಂದರೆ ಇರುತ್ತೆ. ಬರೀ ನೀವು ಅಂತ ಹೇಳಿದ್ದು ಅನ್ಕೋಬೇಡಿ.
Cataract, glaucoma, diabetic retinopathy is for your family members also. Most of them won't be knowing. You heard by
Usually they don't have problems, so they think that it is
that's
not.
why I was stressing again and again. Anyone in your family, glaucoma, relatives, or ಯಾರಿಗೋ ಒಬ್ಬರಿಗೆ ಇರ್ಬೋದು. So periodic eye checkup first. So ಏನು ಹೇಳ್ತೀರಾ ಮನೆಯಲ್ಲಿ ಡಯಾಬಿಟಿಸ್ ಹೈಪರ್ಟೆನ್ಷನ್ ಬಗ್ಗೆ ಟ್ಯಾಬ್ಲೆಟ್ ತಗೋತಾ ಇದ್ರೆ ಅಷ್ಟೇ ಕೇಳ್ಬಿಟ್ಟು ಬಿಟ್ಬಿಡ್ತೀರಾ ಮತ್ತೆ ಫಸ್ಟ್ ಐ ಚೆಕಪ್ ಹೋಗ್ಬೇಕು ನೋಡಿ ಯಾವ ಸ್ಟೇಜಲ್ಲಿ ಇದೆ ಏನು ಅಂತ ಆಮೇಲೆ ಆಮೇಲೆ ಎಲ್ಲ ಸರಿ ಇದ್ರೆ ಹೋಗಿ ತೋರಿಸ್ಕೋಬೇಕಲ್ಲ ಸೊ ಎನಿವನ್ ಹೂಮ್ ಯು ನೋ is diabetic or hypertensive, please tell them that they have to go for an eye checkup at the earliest so that the major damage and vision can be okay. Again, doubt ಇಲ್ಲ
ನಾನು ಫಿಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಿದ್ದೀನಿ ಬಟ್ ಅದು ನಾನು ರೆಗ್ಯುಲರ್ ಆಗಿ ಅಂದರೆ ಎಚ್ಚರಿಕೆ ಇದ್ದಾಗ ಯಾವಾಗಲೂ ಯೂಸ್ ಮಾಡೋದಿಲ್ಲ.
ನಾನು ಸ್ಪೆಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಿದ್ದೀನಿ ಬಟ್ ಅದನ್ನು ಎವ್ರಿ ಟೈಮ್ ಹಾಕೋದಿಲ್ಲ, ಬರೀ ಕ್ಲಾಸಲ್ಲಿ ಮಾತ್ರ ಬೋರ್ಡ್ ಮೇಲೆ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ ಮಾತ್ರ ಯೂಸ್ ಮಾಡ್ತೀನಿ. ಸೊ ನಾನೀಗ ಅದನ್ನು ಬೆಳಗ್ಗೆಯಿಂದ ಸಾಯಂಕಾಲವರೆಗೂ ಯೂಸ್ ಮಾಡ್ತಾನೆ ಇರಬೇಕಾ ಅಥವಾ
ರೆಗ್ಯುಲರ್ ಆಗಿ ಬೋರ್ಡ್ ಮೇಲೆ ನೀನು ಅಕ್ಷರ ಫೋಕಸ್ ಮಾಡ್ತೀಯಾ ಸೊ ಇಟ್ ಇಸ್ ಹೆಲ್ಪಿಂಗ್ ಯು. ಇವಾಗ ಇಲ್ಲಿ ಓಡಾಡಬೇಕಂದ್ರೆ ಕಾಣಿಸುತ್ತೆ ಬಟ್ ಎನಿಥಿಂಗ್ ಕ್ಲಾರಿಟಿಯಿಂದ ಬೇಕು ಅಂತ ಸ್ಪೆಕ್ಸ್ ಯೂಸ್ ಮಾಡಬೇಕು. ಲೈಕ್ ಐ ಸೆಡ್ ಅದು ನೀವು ಏನು ಕೊಡೋದು ಸ್ಪೆಕ್ಸು ಆ ಇಮೇಜು ಕರೆಕ್ಟಾಗಿ ರೆಟಿನಾ ಮೇಲೆ ಬೀಳುತ್ತೆ, ಮುಂದೆ ಹಿಂದೆ ಬಿದ್ದರೆ ಕಾಣಿಸುತ್ತೆ. ಸೊ ನಾರ್ಮಲ್ ಆಗಿ ಓಡಾಡಬೇಕಂದ್ರೆ ಕಾಣಿಸ್ತಾ ಇದೆ ಅಂತ ಅನ್ಸುತ್ತೆ ಬಟ್ ದಟ್ ವಿಲ್ ಅವಾಯ್ಡ್ ಯುವರ್ ಡಿಸ್ಕಂಫರ್ಟ್. ಸ್ಪೆಕ್ಸ್ ಯೂಸೇಜ್ ಈಸ್ ಫುಲ್ ಟೈಮ್ in each particular duration ಆದರೆ
If you don't use it, any problem? If you don't use it,
over a period of time we'll have discomfort. ಒಂದೊಂದ್ಸತಿ ಪವರ್ ಹೆಚ್ಚಾಗಿದ್ರೇನು ಗೊತ್ತಾಗುತ್ತೆ. ಪವರು ಅವರು ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡಿಲ್ಲ ಅಂದರೆ ಸಪೋಸ್ -1 ಟೈಮ್ ಅಂತ ತೊಗೊಂಡಿರ್ತಾರೆ, ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡಿಲ್ಲ ಅಂದರೆ ಅದು -2 -3 ಹೋದ್ರೂ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ರೆಗ್ಯುಲರ್ ಯೂಸೇಜ್ ಇದ್ದರೆ ಸಟಲ್ ಚೇಂಜಸ್ಸು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಇಫ್ ಎನಿ ಪವರ್ ವೇರಿಯೇಷನ್ ಇಸ್ ದೇರ್ ದೇ ಕ್ಯಾನ್ ಚೇಂಜ್ ದ ಗ್ಲಾಸಸ್. Because till 2021 power is there.
ಸೊ ನಾವು ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡ್ತಿದ್ರೂ ಚೇಂಜಸ್ ಆಗ್ತಾ ಇರುತ್ತೆ.
18-19 ತನಕ ಇರುತ್ತೆ. That's why he is very keen, no plastic surgery 18-18. ಪವರ್ ಸ್ಟೇಬಿಲೈಸ್ ಆಗುತ್ತೆ. ಕೆಲವ್ರಿಗೆ 0.25 0.5 ಆ ಥರ ವೇರಿಯೇಷನ್ ಬರ್ತಾ ಇರುತ್ತೆ, ಹಾಗಾಗಿ ರೆಗ್ಯುಲರ್ ಬನ್ನಿ ಅಂತ ಹೇಳ್ತಾರೆ. So better always specs usage ಇದೆ ಅಂದರೆ ರೆಗ್ಯುಲರ್ ಆಗಿ ಯೂಸ್ ಮಾಡಲೇಬೇಕು.
Four years ಇಂದ ಸ್ಪೆಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಸ್ಟಿಲ್ ಎವ್ರಿ ಇಯರ್ ಪವರ್ ರೈಸ್ ಆಗ್ತದೆ. ಸೊ ಸ್ಟೇಬಲ್ ಆಗಿಲ್ಲ ಮತ್ತೆ ಕಡಿಮೆ ಸೊ ಸ್ಟೇಬಲ್ ಆಗ್ತಿಲ್ಲ. ಅಂದರೆ ಏನಾರ ಮೆಜರ್ಸ್ ಇದೆ ನಾನು ತಗೋಬೋದು.
till that particular 18 already some growing period. So ಏನಂದ್ರೆ ಪವರ್ ಹೆಚ್ಚಾಗ್ತಾ ಇರುತ್ತೆ, ಐಬಾಲ್ ಲಾಂಗ್ ಆಗ್ತಾ ಇದೆ. Because of your eyeball is lengthy, only you will be having power issues. So ಅದು ಕಡಿಮೆಗಂತೂ ಬರಲ್ಲ, just because ನಾವು ಸ್ಪೆಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ರಿಂದ 3 ಇಂದ 2 ಬರಲ್ಲ. ಸೊ ಇಟ್ಸ್ ಜನರಲ್ ಕ್ವಶನ್, ನಾಟ್ ಓನ್ಲಿ ಹಿ. ಎಷ್ಟೊಂದು ಜನ ಪೇಷಂಟ್ಸ್ ಕೇಳ್ತಾರೆ, ನಾನು ರೆಗ್ಯುಲರ್ ಆಗಿ ಸ್ಪೆಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಮತ್ತೆ ಯಾಕೆ ಯೂಸ್ ಮಾಡಬೇಕು, ಇಟ್ ಶುಡ್ ಸ್ಟಾಪ್ ಅಲ್ವಾ, ಕಂಟ್ರೋಲ್ ಆಗಬೇಕಲ್ಲ. ಏನಂದ್ರೆ ಒಂದ್ಸತಿ ಪವರ್ ಬರೋದು ನಮ್ಮ ಐಬಾಲ್ ಸ್ಟ್ರಕ್ಚರ್ ಮೇಲೆ ಹೋಗುತ್ತೆ. ಉದ್ದಕ್ಕಿದ್ರೆ ಲೆಂತ್ ಇದ್ರೆ ಆಕ್ಸಿಯಲ್ ಲೆಂತ್ ಆಫ್ ದ ಐಬಾಲ್ ಮಯೋಪಿಕ್ ಐ ಬರುತ್ತೆ. ಲೈಕ್ ಐ ಸೆಡ್ ಅದು ಇಮೇಜ್ ಮುಂದೆ ಫಾರ್ಮ್ ಆಗುತ್ತೆ, ಸೊ ಮಯೋಪಿಕ್ ಬರುತ್ತೆ. ಟಿಲ್ ಹಿ ಈಸ್ ಹ್ಯಾವಿಂಗ್ ದ ಗ್ರೋಯಿಂಗ್ ಪೀರಿಯಡ್ 18, 19, 20 ತನಕನೂ ಈ ಇಶ್ಯೂಸ್ ಇರುತ್ತೆ. ದೆನ್ ಇಟ್ ವಿಲ್ ಕಮ್ ಡೌನ್, ಬಟ್ ಇಟ್ ಡಿಪೆಂಡ್ಸ್ ಆನ್ ಅವರ್ ಜೆನೆಟಿಕ್ಸ್ ಎವ್ರಿಥಿಂಗ್ ಆಲ್ಸೋ. ಸೊ ಅವಾಗ ತನಕನೂ ಸ್ವಲ್ಪ ಡೆಫಿನೆಟ್ಲಿ ಇನ್ಕ್ರೀಸ್ ಇರುತ್ತೆ. ಅಲಾಂಗ್ ವಿತ್ ದಟ್ ರೆಗ್ಯುಲರ್ ಆಗಿ ಹೋಗಬೇಕು. ಮಯೋಪಿಕ್ ಅಂದರೆ ದೆರ್ ವಿಲ್ ಇಟ್ ಅಸೋಸಿಯೇಟೆಡ್ ಕಂಡೀಷನ್ಸ್ ಆಲ್ಸೋ. ರೆಗ್ಯುಲರ್ ಆಗಿ ಹೋಗಿ ಚೆಕ್ಅಪ್ ಮಾಡಿಸ್ಬೇಕು. ಒಂದೊಂದ್ಸತಿ ನೋ ಒನ್ ಆಸ್ಕ್ಡ್ ಆಕ್ಚುಲಿ, ಒಂದೊಂದ್ಸತಿ ಒಂದು ಪವರಲ್ಲಿ ಹೆಚ್ಚು ಪವರ್ ಇರುತ್ತೆ, ಲೈಕ್ -4, ಇನ್ನೊಂದರಲ್ಲಿ -2 ಇರುತ್ತೆ. ಓಕೆ, ನಾಟ್ ನೆಸೆಸರಿ ಇದರಲ್ಲಿ -1 ಅಂದರೆ ಇದರಲ್ಲೂ -1 ಇರಬೇಕಂತಿಲ್ಲ. ಓಕೆ, ಬಟ್ ವಾಟ್ ಎವರ್ ದ ಕಂಡೀಷನ್ ಇಸ್ ರೆಗ್ಯುಲರ್ ಗ್ಲಾಸಸ್ ಮಸ್ಟ್. ನಿಮಗೆ 18 to 20 years ಆ ಥರ ಬಂತು, ಅವಾಗ ಇಂಟ್ರೆಸ್ಟ್ ಇಲ್ಲ, ನನಗೆ ಫೆಡ್ ಅಪ್ ಆಫ್ ಗ್ಲಾಸಸ್ ಇಷ್ಟು ವರ್ಷದಿಂದ ಹಾಕಿದ್ದೀನಿ, ಕಾಂಟ್ಯಾಕ್ಟ್ ಲೆನ್ಸು ಕೆಲವ್ರಿಗೆ ಆಗಲ್ಲ, ದೇ ವೋಂಟ್ ಫೀಲ್ ಕಂಫರ್ಟಬಲ್. ಅವಾಗ ಇಫ್ ಯು ಸ್ಟಿಲ್ ಇಂಟ್ರೆಸ್ಟೆಡ್ ದೆನ್ ಯು ಕ್ಯಾನ್ ಪ್ಲಾನ್ ಲೈಕ್ ಹಿ ಈಸ್ ಆಲ್ರೆಡಿ ಮೇಡ್ ಹಿಸ್ ಮೈಂಡ್, ಪ್ಲಾನ್ ಮಾಡ್ಬೋದು. ಓಕೆ, ಬಟ್ ಇವಾಗ ಎಷ್ಟೋ ಜನಕ್ಕೆ ಸ್ಪೆಕ್ಸ್ ಕಂಟಿನ್ಯೂ ಮಾಡೋದು ಇಷ್ಟ. ಅದು ಹಾಗಂತ ನನಗೆ ಪವರ್ ಹೆಚ್ಚಾಗ್ತದೆ, ಸೊ ಐ ಆಮ್ ಸಮಥಿಂಗ್. ಇಟ್ ಇಸ್ ನಾಟ್ ಲೈಕ್ ದಟ್. ಇಟ್ ಹ್ಯಾಪನ್ಸ್ ಫಾರ್ ಎವ್ರಿ ಒನ್. ಕೆಲವರಿಗೆ -1 -2 ವೇರಿಯೇಷನ್ ಬರುತ್ತೆ, ಕೆಲವರಿಗೆ 0.25 0.5 ಬರುತ್ತೆ. ಓಕೆ, ಫಾರ್ 2 people 14 years ಆದ್ಮೇಲೆ ಹೆಚ್ಚೇ ಆಗಲ್ಲ, ಕೆಲವರಿಗೆ 21 ವೇರಿಯೇಷನ್ ಬರುತ್ತೆ. ಇಟ್ಸ್ ಆಲ್ ಡಿಪೆಂಡ್ಸ್ ಆನ್ ಅವರ್. ಓಕೆ, ಸೊ ಡೋಂಟ್ ವರಿ, ರೆಗ್ಯುಲರ್ ಚೆಕ್ಅಪ್ ಬರ್ತಾ ಇರಬೇಕು. ಪವರ್ ಹೆಚ್ಚಾಗೋಯ್ತು ಅಂತ ಅಪ್ರಿಹೆನ್ಷನ್ ಟೆನ್ಷನ್ ಬೇಡ. ಬಿಕಾಸ್ ಈಚ್ ಇಂಡಿವಿಜುವಲ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್. ಕೆಲವರು ಎತ್ತರ ಇರ್ತಾರೆ, ಕೆಲವರು ಶಾರ್ಟ್ ಇರ್ತಾರೆ, ಅದೇ ಥರ ನಮ್ಮ ಕಣ್ಣು. ದಟ್ ಇಸ್ ಹೌ ವಿ ಹ್ಯಾವ್ ಡಿಫ್ರೆಂಟ್ ಪವರ್ಸ್, ಡಿಫ್ರೆಂಟ್ ಕಂಡೀಷನ್ಸ್ ಎಲ್ಲ. ಓಕೆ, ಸೊ ರೆಗ್ಯುಲರ್ ಚೆಕಪ್ಸ್ ಅರೌಂಡ್ 20 to 30. ಓಕೆ, ಸೊ ಡಾಟ್ ಅಂದರೆ ಡಾಟ್ 80 ಇಲ್ಲ, 20-21 ಸ್ವಲ್ಪ ವೇರಿಯೇಷನ್ಸ್ ಇರುತ್ತೆ ಕೆಲವು. ಸೊ ನಾಟ್ ಟು ವರಿ, ಬಟ್ ರೆಗ್ಯುಲರ್ ಯೂಸೇಜ್ ಇರಬೇಕು. ಓಕೆ,
ಮ್ಯಾಮ್ ಅವಾಗಲೇ ಗ್ಲೋಕೋಮಾ ಅಂದ್ರಲ್ಲ, ಅದು ಯಾವ ರೀತಿ ನಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ ನಮ್ಗೆ ಗ್ಲೋಕೋಮಾ ಇದೆ ಅಂತ?
ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಗ್ಲೋಕೋಮಾ ಇನ್ಸಿಡೆಂಟಲ್ ಇರುತ್ತೆ. ದೇರ್ ಆರ್ ವೇರಿಯೇಷನ್ಸ್ ಅಲ್ಲಿ. ಗ್ಲೋಕೋಮಾ ಅನ್ನೋದು ಜನರಲ್ ಟರ್ಮ್. ಸೊ ಜನರಲಿ ನಾವು ಗ್ಲೋಕೋಮಾ ಸ್ಕ್ರೀನಿಂಗ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಯಾವಾಗ ನೋಟಿಸ್ ಇದು ಮಾಡೋದು ಅಂದ್ರೆ, ಇಂಪಾರ್ಟೆನ್ಸ್ ಕೊಡೋದು ಅಂದ್ರೆ 40 years. 40 years ಇಂದ ವಿ ಸ್ಟಾರ್ಟ್ ಡೂಯಿಂಗ್ ದ ಗ್ಲೋಕೋಮಾ ಸ್ಕ್ರೀನಿಂಗ್. ಬಟ್ ಇನ್ ಸಮ್ ಕಂಡೀಷನ್ಸ್ ಅಂದ್ರೆ, ಇವಾಗ ಮನೆಯಲ್ಲಿ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ಗೆ ಯಾರಿಗಾದ್ರೂ ಗ್ಲೋಕೋಮಾ ಇದ್ರೆ ಅವ್ರಿಗೆ ಜನರಲಿ ದೇ ಟೆಲ್, ಆಕ್ಚುಲಿ ಪೇಷಂಟ್ಸ್ ಬಂದಾಗ, ಇಲ್ಲ ನಮ್ಮ ಮನೆಯಲ್ಲಿ ನಮ್ಮ ತಾಯಿ ಗ್ಲೋಕೋಮಾ ಇತ್ತು, ನಮ್ಮ ಅಣ್ಣನಿಗಿದೆ, ನಮ್ಮ ತಂದೆಗಿತ್ತು ಅಂತ. ಸೊ ದಟ್ ಟೈಮ್ ವಿ ಹ್ಯಾವ್ ಟು ಕಾನ್ಸಂಟ್ರೇಟ್ ಮೋರ್, ಯಾಕಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ 20 to 25% ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಓಕೆ, ಸೊ ಯಂಗ್ ಏಜ್ ಗ್ರೂಪಲ್ಲಿ ಕಡಿಮೆ ಇದೆ, ಬಟ್ ಸ್ಟಿಲ್ ನಾನು ಏನಕ್ಕೆ ಆ ಟಾಪಿಕ್ ತಗೊಂಡಿದ್ದು, ಇವಾಗ ಹೇಳಿದ್ದು ನಿಮಗೆಲ್ಲ ಎಜುಕೇಟ್ ಮಾಡಿದ್ದು, ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಸ್ಪೆಕ್ಸ್, ಆಲ್ ಆಫ್ ಯುವರ್ ಸ್ಪೆಕ್ಸೇ ಮೇನ್ ಇಶ್ಯೂ. ಬಟ್ ಏನಕ್ಕೆ ಗ್ಲೋಕೋಮಾ, ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಇದೆಲ್ಲ ಹೇಳಿದ್ದು, ಡಯಾಬಿಟಿಕ್ ರೆಟಿನೋಪತಿ, ಈಸ್ ಆರ್ ದ ಬರ್ನಿಂಗ್ ಇಶ್ಯೂಸ್ ಅಂಡ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಇಗ್ನೋರ್ ಆಗೋಗ್ತಾ ಇದೆ, ಜನರ ಹತ್ರ ರೀಚ್ ಆಗ್ತಾ ಇಲ್ಲ. ಸೊ ನೀವು ನಿಮ್ಮ ಮನೆಗೆ ಹೋದಾಗ ನಿಮ್ಮ ತಂದೆ ತಾಯಿ ಪ್ಲಸ್ ನಿಮ್ಗೆ ಗೊತ್ತಿರೋ ರಿಲೇಟಿವ್ಸ್ಗೂ ಎಲ್ಲ, ಯಾಕಂದ್ರೆ ಎಷ್ಟೊಂದು ಸತಿ ಶುಗರ್ ಅಂದ್ರೆ ಶುಗರ್ ಟೆಸ್ಟ್ ಹೋದ್ವಿ, ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇದೆ, ಸಾಕು ಟ್ಯಾಬ್ಲೆಟ್ಸ್. ಬಟ್ ಶುಗರ್ ಇಂದ ಕಿಡ್ನಿ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ, ಕಣ್ಣು, ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಕಣ್ಣು, ಐ ಈಸ್ ಆಲ್ವೇಸ್ ನೆಗ್ಲೆಕ್ಟೆಡ್. ಏನೋ ಕಾಣಿಸ್ತಾ ಇದೆ, ಸಾಕು ಬಿಡುವ, ಕಾಣಿಸ್ತಾ ಇದೆ, ಇಷ್ಟೇ ಇರುತ್ತೆ. ಎಷ್ಟು ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ, ಹಿಂಗಿದೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ. ಸೊ ಟು ಅವಾಯ್ಡ್ ಆಲ್ ದಿಸ್ ಡಯಾಬಿಟಿಸ್ ರಿಲೇಟೆಡ್ ಬ್ಲೈಂಡ್ನೆಸ್ ಇಶ್ಯೂ, ವಿ ಆಲ್ವೇಸ್ ಎಜುಕೇಟ್ ದ ಪೇಷಂಟ್. ನಾರ್ಮಲ್ ನನ್ನ ಹತ್ರ ಬರೋ ನಾರ್ಮಲ್ ಪೇಷಂಟ್ಸ್ಗೂ ಒಂದೇ ಹೇಳೋದು, ಸರ್ ಇವತ್ತಿಗೆ ಇಲ್ಲ, ನಿಮ್ಮ ಮನೇಲಿ ಯಾರಿಗಾದ್ರೂ ಡಯಾಬಿಟಿಸು, ಹೈಪರ್ ಟೆನ್ಷನ್ ಇದೆ, ದಯವಿಟ್ಟು ಅವ್ರನ್ನೆಲ್ಲ ಐ ಚೆಕಪ್ ಮಾಡಿಸ್ಕೊಂಡು ಹೇಳಿ. ಓಕೆ, ಸೊ ಗ್ಲೋಕೋಮಾ, ಡಯಾಬಿಟಿಸ್ ಯಂಗ್ ಏಜ್ ಗ್ರೂಪಲ್ಲೂ ಇರ್ಬೋದು. ನಾವು ಇಟ್ಸ್ ವೆರಿ ಕಾಮನ್, 30-40 ಬರುತ್ತೆ. ಸೊ ಎನಿವನ್ ಹೂ ಇಸ್ ಡಯಾಬಿಟಿಕ್, ಐ ಚೆಕಪ್ ಇಸ್ ಮಸ್ಟ್. ಗ್ಲೋಕೋಮಾ ಗೊತ್ತಿರೋರೆಲ್ಲರೂ ಪೀರಿಯಾಡಿಕ್ ಚೆಕಪ್ ಮಾಡ್ಕೋಬೇಕು. ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಪ್ರಿವೆಂಟೆಡ್ ವಿತ್ ಐ ಡ್ರಾಪ್ಸ್, ಟ್ಯಾಬ್ಲೆಟ್ಸ್, ಅಂಡ್ ಸಮಟೈಮ್ಸ್ ಇಫ್ ಇಟ್ ಇಸ್ ಅಡ್ವಾನ್ಸ್ ಥ್ರೂ ಸರ್ಜರಿ. ನ್ಯಾಚುರಲ್ ಮೆಡಿಸಿನ್ಸ್ ಅಂದ್ರೆ ನಾವು ನೋಡಿ ಹೇಳ್ಬೇಕು, ಲೈಕ್ ಲೂಬ್ರಿಕೇಟಿಂಗ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್. ಬಟ್ ಅದು ನಿಮ್ಗೆ ಏನು ಕಂಡೀಷನ್ ಅದು ನೋಡ್ಕೊಂಡು ಹೇಳ್ಬೇಕು. ಹೆಲ್ದಿ ಫುಡ್, ಆಲ್ ವೆಜಿಟೇಬಲ್ಸ್, ಫ್ಲಾಕ್ಸ್ ಸೀಡ್ಸು, ಇದೆಲ್ಲ ಎಲ್ಲ ವೆಜಿಟೇಬಲ್ಸ್, ಎಲ್ಲ ನಾವು ವೆಜಿಟೇಬಲ್ಸ್, ಫ್ರೂಟ್ಸ್ ಎಲ್ಲ ಇರುತ್ತೆ, ನಾವು ಕರೆಕ್ಟಾಗಿ ತಿನ್ಬೇಕು ಅಷ್ಟೇ. ಓಕೆ, ಆಲ್ ಗ್ರೀನ್ ಲೀಫಿ ವೆಜಿಟೇಬಲ್ಸ್, ಆರೆಂಜ್ ಅಂಡ್ ಯೆಲ್ಲೋ, ಎವ್ರಿಥಿಂಗ್, ಈ ಕಲರ್ ಎಲ್ಲ ವೆಜಿಟೇಬಲ್ಸು ತಿನ್ಬೇಕು. ಓಕೆ, ಏನಾದ್ರು ಡೌಟ್ಸ್ ಇದೆಯಾ?
Sometimes we will be yawning. At that time, our eyes will be filling with eye drops. So, why it happens?
Naturally. That is not because of dryness or anything. Okay, yawning is because of lack of oxygen.
Or it could break out wherever case.
So that is normal, natural. That is not abnormal. Okay, because of lack of oxygen, we'll keep yawning. Adrinda tears ಬರುತ್ತೆ, but it's not related to dryness or anything. Okay, so ಏನು ಮಾಡಬೇಕು? ಡ್ರೈನೆಸ್, ಕಂಪ್ಲೀಟ್ ಪ್ರಾಬ್ಲಮ್ ಬಂದರೆ ಯೂಸೇಜ್ ಮಾಡೋದಿಲ್ಲ. ಇನ್ನೂ ಒಂದು ಹೇಳಿದೆ ಅಲ್ವಾ, ಬ್ಲಿಂಕಿಂಗ್, ಕಂಪ್ಲೀಟ್ ಬ್ಲಿಂಕ್ ಮಾಡಬೇಕು. ಸೊ ವೆನ್ ಯು ಆರ್ ಲುಕಿಂಗ್ ಸ್ಕ್ರೀನ್, ಮೊಬೈಲ್ ಸಾಕು, ಮೊಬೈಲ್ ಏನು ನೋಡ್ತಾ ಇದ್ದೇನೋ ಬ್ಲಿಂಕ್ ಮಾಡಬೇಕು. ಸೊ ಬ್ಲಿಂಕ್ ಮಾಡಿದ್ರೆ ಡ್ರೈನೆಸ್ಸು, ಇರಿಟೇಷನ್ ಎಲ್ಲ ಹೋಗುತ್ತೆ. Okay.
Good evening, ma'am. I had two myths which I wanted to get it busted. The first one is when we are at home and at the bedtime phone usage. So we sleep on the pillow and the phone is on the pillow itself, and by the sideways we are using the phone. So parents say that it's not good. If you want to use phone, sit properly, sit in a straight position and then use it. So what about that?
ನನ್ನನ್ನು ಕೇಳಿದ್ರೆ ನಿದ್ದೆ ಮಾಡೋಕ್ಕಿಂತ ಮುಂಚೆ ಫೋನ್ ಯೂಸೇ ಮಾಡಬೇಡ. Okay. Too much of bright light. I think that will also cause same ಅಲ್ಲ. Light off ಮಾಡ್ಕೊಂಡು for long time mobile ನೋಡ್ತಾ ಇದ್ರೆ ಏನಾಗುತ್ತೆ? You won't blink. ನಾನು first symptom ಅದೇ ಬಂದಿದೆ. Computer issues ಇವು. Not necessary ಹೆಸರಲ್ಲಿ ಕಂಪ್ಯೂಟರ್ ಇದೆ ಅಂದ್ರೆ ಕಂಪ್ಯೂಟರ್ ಇಂದಾನೆ ಅಂತಲ್ಲ. Any screen. It can be mobile, tab, laptop, TV. Posture ಅಲ್ಲ. Looking at screen for long time will only cause brightness. That is not good. Again, ಅದು brightness adjustments ಮಾಡ್ಕೊತಾರೆ. Saying that I get. Definitely. So try to avoid as much as possible. Second question.
And the second myth is our parents and grandparents they had said that eating carrots is good for us. So like, is it completely true or is it just a myth?
I think any vegetable is good to be frank. Not only carrot. Vitamin A ಬರುತ್ತಲ್ಲ. It's not like with ಅಂದ್ರೆ ಅದೇನೋ carrot ಅಂತಲ್ಲ. Any vegetables which is good, rich in vitamin A. ಅದಕ್ಕೆ I answered in like green leaf vegetables, anything with orange or yellow color, red color like mango, papaya, ಎಲ್ಲಾನು. Even egg and spinach, everything. ಸೊಪ್ಪು ಎಲ್ಲಾನು. ಏನಕ್ಕೆ ವಿಟಮಿನ್ ಎ ಬೇಕು ನಮಗೆ ಮೇನ್ ಆಗಿ. ರೊಡಾಕ್ಸಿನ್ ಸೈಕಲ್ ಅಂತ ಒಂದು ಬರುತ್ತೆ. For all this we need vitamin A ಅಷ್ಟೇ. ಕೆರೋಟಿನ್ಸ್ ಇರುತ್ತೆ ಅಂತ ಆ ಕಾಲದಿಂದ ಕ್ಯಾರೆಟ್ ಅನ್ನು ಹೈಲೈಟ್ ಮಾಡಿದ್ರು. But all these things, anything which is yellow, red, orange, green, all this helps in vitamin A production. ಬೇಕಾಗಿದ್ದು vitamin A ಅಷ್ಟೇ. ಅದರಲ್ಲಿ ಕ್ಯಾರೆಟ್ ಅನ್ನು ಆ ಕಾಲದಿಂದ ಹೈಲೈಟ್ ಮಾಡಿದ್ರು. ಮಿಕ್ಕಿದ್ದು okay, all this anything whatever you see yellow, orange, red, everything is good. Okay. Any other questions? ಅಷ್ಟೇನಾ? ಅಷ್ಟೇನಾ? Thank you everyone for giving me this opportunity.
Thank you, ma'am, for your valuable time. Ma'am started the session with basic eye structure. Then ma'am explained us about how to take care of our eye in day-to-day life. Then ma'am educated us about different types of eye diseases and disorders and what all precautions can be taken to avoid such disorders. Even the Q&A session or the question and answer session was informative and interactive. Thank you, ma'am, for your valuable time. Now we shall felicitate ma'am with a token of love from the side of SRVM family.
I thank Swamiji and Mr. Girish because Swamiji had spoken to our director, Dr. Rajshekar. And the moment he spoke, he called me and told, go to Ramanashram Vidhya Mandira, do what is the best for you, best for the students. I am really proud I am working for Dr. Rajshekar because he is a symbol of high quality. What you can expect from a person, quality like passion, sincerity, honesty, hard work, is an example of that. And he was a person, one among like you. He would have been sitting like you. But today he has become he has become an example of highest quality in the society. He studied here, he stayed here for 8 years, and all meetings he attended here, even today also. Whenever there is a meeting, he is not keeping well. Otherwise, he would have been happy to be with you. So I see around 80 students here. I hope you are the future of the country. You are the future, because today present you are lucky to have a Prime Minister like Modi, who has taken our country to a very big height. Correct? Whether it is military, economically, or education-wise, irrigation, electricity, every transport, housing, healthcare, everything he is trying to impart, give you the best. Similarly, you as a student, you should work hard, bring the name similar to Dr. Rajshekhar sir, so that Swamiji, all Ramashraman, everybody will be very happy. I am sincerely telling you, he is a great personality. He is he doesn't have any habit. I can tell you about an example of a passion. 10 years back, Madam told about cataract. They have to remove the opaque lens or turbid lens or clouded lens. They make 18 mm incision, and they will put suture. After cataract surgery, they have to lay down in the bed. They should not cough. 1 month they have to lay down. They should not take bath and all. The technology has improved. Instead of 18 mm putting stitch, now they do 1.8 mm. What is 1.8 mm? Girish is an engineering student. He knows it is the size of a ballpoint tip size. So we got a machine. First time in India we got a machine. Dr. Rajshekhar sir always brings new technology, because he wanted to give this hospital a patient-centric hospital. They want to be the best to the people. So he introduced this machine. And when this machine came, it came from Germany. US from Germany came from US. At least 1 week, every day afternoon, just like you have seen children, babies, if you give a toy, that toy will be with her for about 2 days or 3 days. If like that, doctor used to go to the OT for every 2 hours, at least 2 hours a day, and used to practice that, how to operate with that. And he like that, he has a passion. So we wish you, I am really proud I am working under him. So you should also be proud there is a Dr. Rajshekhar. Now he is the president of Private Hospital Association, and he is the founder member of Bangalore Ophthalmic Society. We were a teaching institute, because COVID time we stopped it. Otherwise we were, Madam taught you now, made you understand about ophthalmology. Very difficult task, but she did it very nicely, because to learn becoming an eye doctor, they have to study 6 years, including that house surgery, 6 years in MBBS, then 2 years diploma, then 2 years MS, and most difficult subject is her subject, Retina. Why? If you study MBBS, there will be this much book. When you study diploma, you will have 20 books. But when you study about Retina, that is the most unrewarding thing, because as Madam has said, once diabetes sets in, it is continuous. You cannot escape from that. To an extent only, Madam can help. So she has studied a very tough subject. They have studied almost 10 years to become an eye doctor, retina specialist. So she has explained you all these things. So try to make you utilize, and I hope 80 people of you will become like Rajshekhar and make the country, make Ramakrishnaman as the proud of you. All the best.
Priyam Kundali Kakshah Sarva Yagneshwaro Hari Tasmin Sushre